So how are you doing today?
I'm great, how are you?
I'm doing well. I'm Allison. I'm an RN. The doctor told me that you've been in and he's a little concerned about your blood pressure. So he just wants me to do some education with you about what blood pressure is and how it affects your life and what you can do to prevent having higher blood pressure. Does that make sense?
Yes.
Okay, perfect. So blood pressure is how your heart pumps the blood to your body. And we want to see it at a good range of like 120/80. And right now you're running a little bit high. So there's two numbers, like I said, there's a systolic and then there's a diastolic. And so we want to see those in that range. And right now you're a little bit higher than that range. And that's not a big deal. I understand that you're a farmer, that you work probably really long hours, you have your parents living with you, and you also own a bakery. So there's probably a lot of stress. I also understand that your diet consumes probably a lot of fat and sugars. So those are all things that we can manage and change and work on together. So we're just going to talk about right now how to take your blood pressure.
Okay.
So can you tell me that range that we talked about that I want to see your blood pressure at?
120/60.
120/80. But that was good. Yeah, 120/80. Perfect. So that's where we want to see you falling in that range, okay?
Okay.
All right, perfect. So the reason that blood pressure and keeping your blood pressure down is really important is because it could lead to a heart attack. But the number one cause of a stroke is high blood pressure as well. So it's also known as the silent killer. So what we want to prevent is from you going too high and not knowing that it's that high and then something happening. And a stroke is something that affects your brain, and it can affect one side of your brain, and it can leave you paralyzed. You wouldn't be able to move part of your body. There could be some serious complications that come from that. So we want to just make sure that we prevent that from occurring. So what are we trying to prevent again?
A stroke.
Perfect. That's absolutely right, sir. So the other name that we refer to for blood pressure is hypertension. And 1 in 4 people in the United States has hypertension. And 1 in 3 do not know. Like you did not know for a while. There's not a lot of signs until it gets too bad for people to know and be aware of it. So that's why we're here. So the American Heart Association is an organization in the United States. I'm not sure if you're familiar with that. But what they do is they come up with some guidelines and regulations for doctors to follow with their patients. And that's where that blood pressure comes in, that 120/80. They've come up with that's a good range for it to be at. And they've found that people who are higher lead to those strokes and heart attacks. Does that make sense to you?
Yes.
Okay, so what are we going to have that range at? What do we want to be at?
120/80.
Perfect, that's exactly right. So what I'm here to do today is I'm going to teach you how to take your blood pressure. And so I got you this machine, and I know we kind of talked with the pastor of your church, and he was in agreement that because it would be pretty bad for you to lead to a stroke, that it's okay for you to use this machine for your health. So he's in agreement to that. So I'm going to teach you how to use it and take it. So first I'll teach you, and then we'll do it together. And then I'll have you do it on your own and just give you some tips and feedback on that.
Okay.
Sound like a plan?
Yes.
Perfect. So it's pretty easy. What we're going to do is undo this. You see this arrow here?
Mm-hmm.
So that's for your artery. And you have an artery in your arm. And it's always right about center. So that's where we want that to be at. And this is going to go up over top of your bicep. Okay?
Okay.
Perfect. So we're going to slide your arm in. And then you want to tighten it up. Make sure we have it centered. Perfect. Alright. And we just want to relax. We don't want to be talking while we're doing it. We don't want to be moving. We just want to be in a relaxed position, okay? So then all you have to do with this machine is just hit start. Give it a second, and then it should pump right on up for you. So the way that this is doing it is it pumps, and when it gets to a certain point where your heartbeat isn't happening anymore, it's going to start to release. And when it starts to feel back your heartbeat picking up again, and then that's how they're going to be able to tell where you're at. Okay. So what was that number we're looking at?
120/80.
Perfect. So you're a little bit high right now. You're at 130/89. So a little bit higher than we'd like you to be at. And this is a perfect way for you to learn where we want to be at.
Okay.
Okay? So this next one, we're going to do it together, and you're going to help me walk you through it, okay? So do you remember what we're going to do?
Yes. Gonna open it up,
Mm-hmm.
slide it on.
Mm-hmm. And what are we looking for when we get to the arm?
The arrow is gonna be in the middle where the artery is.
Mm-hmm. And this is called your intercubital.
Okay.
But we can also just call it the elbow bend. And then we're going to wrap it around.
Nice and tight.
Okay. And then we're going to press start. And we want to give it a few minutes, so we're not going to do it on this one, but we'll do it when you go ahead and do it on your own. So you did really good there. And then after we pump up, we're going to have the two numbers, correct?
Yes.
And then we're going to be looking for that 120/80. And if it's not, that's okay. We're going to be working on ways to reduce that in the next few weeks. But this is just getting you started.
Okay.
What I want you to do is keep track of it with our little tracker. So you put the day of the week, and then you'll put what your blood pressure was. And I want you to take it every day in the morning.
Okay.
So when are we going to take it?
Every day in the morning.
And then you're going to put it down immediately, okay?
Okay.
And then when I come back, we're going to review this and kind of see where your trend is, okay? So let's do this again together. You're doing a really great job, by the way.
Thank you. Does it matter what arm I do it on?
It doesn't, but I'd like you to do it on the same arm every day.
Okay.
So you can pick which arm you want, but just try to do it on the same one every day.
Okay.
And every morning around the same time would be perfect, okay?
Okay.
Perfect. Alright, so you're going to do it on your own. I'm just going to kind of give you some tips and tricks on how to do it, okay? When you're done.
Okay.
Alright, so you go ahead. And I can help you get it around your arm if you need. And it's easy to ask a family member to help you too if you need it.
Okay.
Okay? Excellent. And make sure we're just relaxing our body. Great. You're doing a great job.
Thank you.
Do you have any questions so far for me?
How can I fix my blood pressure?
That's a great question. I think the best way is going to be some changes in your diet, and I can work with you and your wife on that in a few weeks on how we can make small changes that may help to decrease. Also, your stress level, we need to work on decreasing that. So if that means kind of, bringing someone else in to help the family with the business, so you have some more alone time, or you and your wife have some time to just kind of de-stress from the day, that's going to help as well. All right, you did great. So the last thing I want you to do is write it down. So we're going ahead and track it today, okay?
Okay.
Perfect. Awesome. All right, so one last time, let's go ahead and walk through it. So what are we doing when we use this machine?
Checking for our blood pressure.
Okay, and what do we want our blood pressure? What's the range we want to be in?
120/80.
Awesome. And so just verbally, can you tell me how we're going to use the blood pressure machine?
So we're going to undo the cuff, slide it up your arm, make sure the arrow is pointing down the middle of your arm where the artery is,
Mm-hmm.
and then tighten it up nice and tight, and hit the start button, make sure you're relaxed,
Mm-hmm.
and when it's done, record the number.
That's perfect. That's exactly what I want you to do. Did you have any last minute questions or concerns that I could answer for you?
Was there anything I could do to prevent this?
Like I said, in the way that we're same kind of way that we can fix it is how we're going to prevent it. If for some reason it became not manageable through your diet, exercise, and your stress, then we can look at medication. But I think with a few changes, since you're kind of in that pre-hypertension, which means that you're not fully in hypertension, I think with a few lifestyle changes, just changing your diet, what you're eating, maybe trying to work out, and then our stress level, making sure we're not as stressed and we're managing that. All of those things I think will help to reduce your blood pressure.
Okay.
All right. Perfect, Mr. Mitchell. Well, thank you so much. I'll be back in a few weeks. It's nice meeting you. If you have any questions, please reach out to myself or the doctor.
Okay.
All right.
Thank you.